Atrial fibrillation, commonly referred to as Afib, is the most prevalent type of irregular heartbeat or arrhythmia, affecting millions of people worldwide. Despite its frequency, Afib often goes undiagnosed because its symptoms can be subtle, intermittent, or mistaken for other health issues. Yet, early detection is crucial, as untreated Afib significantly increases the risk of stroke, heart failure, and other serious complications. Recognizing the warning signs and understanding the importance of screening can empower individuals to take control of their heart health and seek timely medical intervention. To begin, it is essential to understand what atrial fibrillation is and how it affects the heart. In a healthy heart, electrical signals travel through the atria in a coordinated manner, resulting in a steady, rhythmic heartbeat. In Afib, however, these signals become disorganized, causing the atria to quiver or fibrillate. This irregular movement means the heart cannot pump blood as efficiently as it should, leading to a range of symptoms and increasing the risk of blood clots forming in the heart. These clots can travel to the brain and cause a stroke, making Afib a condition with potentially life-altering consequences if left untreated. Warning signs of atrial fibrillation can vary from person to person. Some individuals may experience noticeable symptoms, while others may have none at all. The most common warning signs include palpitations, which feel like a rapid, fluttering, or pounding heartbeat. Some people describe this as their heart skipping a beat or racing unexpectedly, even when at rest. These palpitations can last for a few seconds, minutes, or even longer. Another frequent symptom is fatigue. Because the heart is not pumping blood effectively, the body's organs and tissues might not receive the oxygen they need. This can lead to persistent tiredness, even after a full night's sleep. Shortness of breath is also common, particularly during physical activity or when lying down. This occurs because the inefficient pumping leads to fluid buildup in the lungs, making it harder to breathe comfortably. Dizziness or lightheadedness can also be warning signs of Afib. Some individuals may even experience fainting spells, known as syncope, especially if their heart rate becomes extremely rapid or slow. Chest discomfort, ranging from mild pressure to severe pain, can be another indicator. While chest pain always warrants immediate medical attention, in the context of Afib, it may signal that the heart is struggling to keep up with the body's demands. It is important to note that some people with Afib have no symptoms at all. This is referred to as silent Afib, and it can be particularly dangerous because individuals may remain unaware of their increased risk for stroke and other complications. For this reason, screening plays a vital role in early detection, especially for those with risk factors such as older age, high blood pressure, diabetes, obesity, sleep apnea, or a family history of heart disease. Screening for Afib can be performed in several ways. The most basic method is simply checking your pulse. A normal heartbeat should feel regular and steady, like the ticking of a clock. If you feel an irregular rhythm, or if your heart sometimes beats faster or slower without any obvious reason, it may be a sign of Afib. Learning to check your pulse at your wrist or neck can be a simple first step towards self-detection. However, pulse checking alone is not definitive. For a more accurate diagnosis, medical professionals rely on an electrocardiogram, or ECG. This test records the electrical activity of the heart and can quickly identify irregular rhythms characteristic of Afib. In some cases, a standard ECG performed during a routine checkup will detect Afib, especially if the arrhythmia is persistent. But Afib can also be paroxysmal, meaning it comes and goes. If symptoms are infrequent, a standard ECG might not capture the abnormal rhythm. In these cases, doctors may recommend ambulatory monitoring, such as a Holter monitor or a vent recorder. These portable devices track your heart's activity over days or weeks, increasing the likelihood of detecting intermittent episodes of Afib. In recent years, advances in technology have made it easier to screen for Afib outside the doctor's office. Wearable devices, such as smartwatches and fitness trackers, now offer heart rate monitoring features that can alert users to irregular rhythms. Some devices use optical sensors or even built-in ECG capabilities to provide real-time feedback. While these tools are not a substitute for medical evaluation, they can serve as valuable screening aids, prompting users to seek professional assessment if abnormalities are detected. Regular screening is especially important for individuals over the age of 65, as the risk of developing AFib increases with age. Those with high blood pressure, diabetes, heart failure, or a prior history of stroke are also at elevated risk and should discuss screening options with their healthcare providers. For people without symptoms but with significant risk factors, routine pulse checks or periodic ECGs may help catch AFib early before complications arise. If AFib is detected, the next steps typically involve confirming the diagnosis and assessing the risk of stroke and other complications. Doctors may order additional tests, such as echocardiography to evaluate heart structure and function, or blood tests to check for underlying conditions like thyroid disease. Management strategies depend on the individual's symptoms, overall health, and risk profile, but may include medications to control heart rate or rhythm, blood thinners to reduce the risk of stroke, and occasionally procedures to restore normal rhythm. The importance of early detection cannot be overstated. Stroke is one of the most feared complications of AFib, and it is often more severe and disabling than strokes from other causes. The good news is that with appropriate management, the risk of stroke can be dramatically reduced. Blood thinners, for example, can lower stroke risk by more than 60% in people with AFib. In addition to medical treatment, lifestyle modifications play a crucial role in managing AFib and reducing its impact. Maintaining a healthy weight, staying physically active, managing blood pressure and diabetes, avoiding excessive alcohol, and treating sleep apnea can all help lower the risk of AFib or its recurrence. In summary, recognizing the warning signs of atrial fibrillation and understanding the value of screening are vital steps in safeguarding your heart health, whether you experience palpitations, fatigue, shortness of breath, dizziness, or have no symptoms at all. Being proactive about heart rhythm monitoring can lead to early diagnosis, effective treatment, and a lower risk of serious complications. If you have risk factors for AFib or notice any concerning symptoms, don't hesitate to speak with your healthcare provider about appropriate screening and next steps. Your heart and your future may depend on it. To learn more, go to kbfitnesshealth.com.